Alabama remains among the lowest states when it comes to vaccination rates in the country. Joining me now in the studio, White House Vaccination Coordinator Dr. Bashir Shukar. And Dr. Shukar, we're socially distanced here, so you're not here with me on the desk, but thank you so much for joining us here on Alabama Live. I'm sure you already know our vaccination rates are the lowest in the country, and you're here to talk to leaders about those numbers. That's correct?
Absolutely. Thank you, Jasmine, for having me here with you today, and it's great to be with you in the studio, even though we're socially distant here. So thank you for having me.
There's a big push nationwide to get more people vaccinated, but our numbers here are still low here in the state of Alabama. Do you think we'll ever get to the point here in Alabama where we'll have enough people vaccinated?
Well, look, the way I look at it, we have gone so far as a country when it comes to vaccination. We're almost 200 million people in this country with at least one dose of the vaccine, almost 170 million people fully vaccinated. So we've done a lot of work. We've done great work, including a lot of great work happening here in Alabama. The fact remains we still have a lot more work to do. We still have tens of millions of people who are eligible to be vaccinated, and we have to do everything we can to get them vaccinated.
What does your team hope to do? What do you hope to hear and learn from Alabama officials on your visit here?
Well, I had a chance to spend some time yesterday with doctors from across the state, spend some time with hospital CEOs and chief medical officers, spend some time with the state health officer, Dr. Harris, and his team. And the fact remains we still have a lot of work to be done. People who are unvaccinated remain at risk. You look at the overwhelming majority of hospitalizations today that are related to COVID. It's amongst people who are unvaccinated. You look at the overwhelming majority of deaths, and by far, it's people who are unvaccinated. We know vaccines work, they're safe, they're effective, they're available anywhere, and it is our path to getting this pandemic behind us and saving lives.
Do you believe things like incentives work?
Well, there are multiple tools in our toolbox, and for some people, incentives work. And for this group of people, if we want to do that incentive, we've seen how some of these would work, whether it's a $100 gift card or $50 gift card or some lotteries in some states, and we've seen that those work for some population. We do need to do everything in our toolbox, if you want. We have to have these one-on-one conversations with people. And I know the people who are undecided still on the vaccine, they still have questions, and we have to be able to get them answers. So that one-on-one conversation with your doctor becomes extremely important. And I had an opportunity to spend some time last night talking to family physicians, pediatricians across the states who are ready to have these conversations with you, ready to give you facts, to give you answers and information, not misinformation, when it comes to those legitimate questions that people who are undecided have. So let's make sure we have those conversations with your doctors, with your nurses, with people you trust. And I have no doubt, Jasmine, when people get facts, when people get answers, they will be more inclined to getting vaccinated, and that's important.
We've been reporting that booster shots are now available in our state, but even for those who are vaccinated, they're wondering, is this our new norm, getting 1, 2, even 3 shots a year as we continue in this pandemic?
Well, what we announced a couple of days ago is our booster plan starting on September 20th. For people who are fully vaccinated with Pfizer or Moderna, they will be eligible to get a booster shot 8 months after their second shot. And the reason why we'd want to do that, after our medical experts and public health experts at the Health and Human Services Department, CDC, and other places have reviewed the data, it became important that if we get that booster shot 8 months after your second shot, we will be able to optimize the benefit of these wonderful vaccines and protect more and more people. So it's important that we do that. We're working on the plans to get that done, of course, as soon as September 20th.
What is your message overall for the state of Alabama, just knowing how low our vaccination rates are and how high our hospitalization rates are right now?
Well, look, I am concerned about the hospitalization rates that we're seeing here. I am concerned about ICU capacity. We're seeing more and more kids in the hospitals here in Alabama. I think there are almost 50 kids in the hospital today. That's more than Alabama kids have been in the hospital throughout the pandemic. We're seeing also more pregnant women ending up in the hospital and having to deliver preterm babies. It's really important that we know we have the tools in our toolbox to help us prevent that. We have 3 effective, very safe vaccines, and we have to make sure that the message is out there for people who are still undecided, who are still thinking about the vaccine. Now is the time. Now is the time to roll up your sleeve and get that shot to protect yourself, protect your family, and protect your community.
Our state has gone back and forth. Pharmacies obviously offering the vaccine, and we've gone back and forth with people having clinics every weekend, every other weekend. Do you think those regular clinics are effective? Are people doing more appointment only that you've been seeing lately?
Well, for a while now, we've been working with states and local governments and pharmacies to make sure that we're making access as easy and as convenient as possible for the vaccines. We'd want to make sure you have the ability to just walk up to a pharmacy and get your vaccination done right away. I spent some time this morning with community health center leaders from across the state who are having vaccines available in those community health centers across every part of the state, making the access to the vaccine as easy and as convenient with extended hours, weekend hours becomes really important, because at the end of the day, we want more people vaccinated, and we'd want to remove all kind of barriers, Jasmine, that would be put against people getting the opportunity to get their shot as soon as possible.
What kind of support can the White House and federal government offer to our hospitals right now that are so strained?
Well, we have been working with the state for a few weeks right now through our surge response teams to be there, available for the state and support the state, whether it's through vaccination efforts, testing efforts, monoclonal antibodies treatment opportunities, working with hospitals. I know our colleagues from Health and Human Services are working with the State Health Department, the Hospital Association here in Alabama, to conduct an assessment of the hospitals and their needs, and we stand ready to do everything we can to support Alabama just the same way we're standing up and supporting Louisiana and Texas and Georgia and other places that are seeing spikes at this point.
Obviously, we're talking about Alabama because of our vaccination rates, but you did mention other states. Are there other states that you're really concerned about in the White House?
Well, here's how I look at it. You know, when you have a virus or a new variant that's much more contagious than the prior variants and then much more contagious than the original virus, and then you have communities with low vaccination rates, when you have these two things together, you create a recipe for a spike. And that's unfortunately what we started seeing in Missouri a few weeks ago. Then now it's Missouri, it's Arkansas, it's Louisiana, it's Florida, it's Texas, it's Georgia, it's Alabama. And we have to continue to do everything we can to get the protection to people. And that really starts with getting as many people vaccinated as possible. And look, I know there are a lot of people who said, you know, back in July, they thought the pandemic is behind us or things are looking better. And they're like, well, I did get along without having to get the vaccine. But now we're realizing that more and more people are getting vaccinated. I think more and more people are realizing that this Delta variant is serious, is much more contagious, is very opportunist when it comes to a virus and finding those who are unvaccinated and infecting them. It's becoming clear that we're seeing more and more people getting vaccinated. Just looking at the Alabama numbers just last week alone, more than 55,000 people got vaccinated for the first time here in Alabama just last week. So we know people are getting more encouraged about getting vaccinated. I think the message is out, and we want to continue to put that message out.
Thank you so much, Dr. Shukare, the White House's vaccination coordinator. Coming up after the break, we're going to continue this discussion talking about vaccines, children, and what we can expect as far as vaccine incentives in the future. And we are continuing our conversation with the White House Vaccination Coordinator, Dr. Shukhair. And Dr. Shukhair, thank you so much again for joining us. We want to talk some about vaccines and children specifically. We know kids over the age of 12 are encouraged to get the shot, but there's still a lot of uncertainty among parents. What is your response for parents who are unsure about this vaccine?
Well, here's how I look at it. The FDA, the CDC, the American Academy of Pediatrics, every expert in this country when it comes to vaccines for children have been recommending the vaccines for 12 to 17 years old. They're safe, they're effective, and we want to make sure that we get as many kids vaccinated as possible, particularly as more and more kids are going back to schools at this point.
With those cases surging now and kids heading back to school, especially here in our area, do you think we'll see a shutdown again across the nation as far as schools?
Well, here's how I think about the schools. You know, there are about 50 million students who are either in schools now or they're going to be in schools over the next few weeks. And we know we all learn best when we're learning in person. And we have no doubt that we can open schools back safely. But there are two really important things that really need to happen. The first part, we have to follow the CDC guidelines when it comes to indoor masking in schools. It's really important, whether you're vaccinated or unvaccinated, to have your mask on while you're in school. The second piece is we'd want to make sure that we're getting everybody who's eligible to get vaccinated, the 12 to 17 years old, so we can create a safe environment for everybody, including those kids under the age of 12 who are not eligible yet to be vaccinated.
And that was my next question. What tips and tricks do you have for parents who have really small kids and are trying to keep them safe during the school year?
Well, it starts, I think, with making sure that we are vaccinating indoors in schools. That's really important. It's also really important that we create a safe environment around those kids. And that means that their older siblings, their parents, their teachers, the staff in schools, they're all getting vaccinated. So we minimize the risk of exposure to those kids until there is a vaccine available for kids under the age of 12.
We're hearing Delta as far as variants. Are we concerned about new variants, and will these current vaccines be able to handle them?
Well, we're definitely concerned about the Delta variant. I think, Jasmine, a couple of months ago, only 1% of our infections in the United States were caused by the Delta variant. Today, it's more than 98% of infections are caused by the Delta variant. If that tells you anything, it tells you how contagious this virus is, how opportunist this variant is. But the fact remains, the more we have people who are unvaccinated, the more we give an opportunity for the virus to replicate, the more we're giving opportunity for this virus to mutate and the ability to have more variants become more likely. That's why it's really all goes back to the same message. We have to do everything we can to protect ourselves, protect our family, protect our communities, and that starts with vaccinations.
Thank you so much, Dr. Shukhair, joining us here on Alabama Live, the White House's vaccination coordinator, talking everything vaccines, hospitalizations, kids, and more here on Alabama Live. Thank you so much for joining us.
Thank you for having me, Jasmine.
And coming up, WSFA First Alert meteorologist Amanda Curran will be back with your forecast. The time now, 11:48. You're watching Alabama Live.